So that's the appearance of patches on CT scan. On MRI, there are 3 bone marrow patterns that have been described. Most importantly, we want to see preservation of the normal yellow marrow, maintenance of the yellow marrow pattern. There's also a speckled marrow pattern, and there's a diffuse sclerosis. Okay. So this is that patient with the proximal humerus Paget's. You can see that the trabecular pattern on this T1 weighted sagittal sequence of the humerus is more prominent where there is Paget's involvement, comparing that trabecular pattern to the normal side. It's very important that we identify these normal areas of yellow marrow in between the thickened trabecula. If you lose these little areas interspersed in normal fat, that's when we have to be concerned that there's something ominous, like a sarcoma that's formed, obliterating that yellow marrow. In this patient with a distal femur, Paget's we saw earlier on X-ray, very prominent trabecular pattern of distal femur compared to the proximal tibia. But yet again, notice how you have these normal interspersed areas of yellow marrow on this T1 weighted sequence. This process, even though it's forming new bone or doing this distorting the bone, it's not displacing the fat, completely obliterating the fat. It's not occupying the entire medullary space. You can still have normal yellow marrow fat between the processes. On a T2 weighted sequence, this is the so-called speckled marrow process. Kind of look like little starry lines. These little bright areas probably represents the fibrovascular tissue that we saw on the pathology slide earlier. Is what these little bright areas probably represent. On this sagittal T1 weighted sequence through the spine, the L2 vertebral body is darker than the rest, but yet if you look carefully, it's not because there's a process that's completely obliterated the yellow fat. There's trabecular thickening, and yet there's still actually yellow marrow in between the areas of the thickened trabecula. That's disease. And here in the left acetabulum, left femur, really in the acetabulum you can see the area of interspersed normal yellow marrow between the thickened coarsened trabecular. So there's patch disease throughout this ischium and ilium. And also notice that how the cortex is thickened. This is cortical thickening on MR. We don't like to look at bony structures on MR very much, cortex, but this is what it will look like. We prefer X-ray or CT. The same patient in the coronal T1 weighted sequence. Again, there's enlargement. If you look at the left pubic bone to the right, notice how it's bigger here than here. So there's enlargement of the medullary space, some cortical thickening, trabecular pattern is more prominent, but most importantly, that yellow marrow is still there. The speckled marrow appearance, fibrovascular tissue on T2 weighted sequence.